Have you ever felt like something wasn't quite right in your body, but you couldn't put your finger on it? What if those strange little symptoms you've been ignoring, like fatigue, itchy skin, or even changes in your nails, were actually warning signs from your liver? In today's video, we're going to uncover 11 of the most unusual and easily missed symptoms of liver damage. Some of them might surprise you. But recognizing these signs early could mean the difference between simple lifestyle changes and irreversible liver disease. The liver is one of the hardest working organs in your body. It filters toxins, produces vital hormones, balances your metabolism, and even has the rare ability to regenerate. But here's the catch: it often suffers in silence. Most people associate liver damage with alcohol abuse, and while that's certainly one cause, it's far from the only one. Everyday habits, like eating sugary processed foods, using common over-the-counter painkillers, cooking with industrial seed oils, or being exposed to hidden toxins like pesticides and plastics, can all take a toll on your liver without you even realizing it. If you've been wondering why your body feels off, or if you want to protect your liver before symptoms become serious, you're in the right place. Stay with us until the end, because we'll not only explore these 11 warning signs in detail, but we'll also share simple, natural ways to help your liver heal and thrive. This is more than just a health check, it's a roadmap to reclaiming your energy, clarity, and vitality from the inside out. Let's get started. 1. Dark urine. Dark urine is an unusual but significant sign of liver damage, often catching individuals by surprise, because urine color is typically associated with hydration levels rather than liver health. The liver is key in processing and removing waste from the body, and any problems with it can change urine color. One of the primary reasons for dark urine in the context of liver damage is the buildup of bilirubin, a yellow pigment formed by the breakdown of red blood cells. Normally, bilirubin is processed by the liver and excreted into the bile, which then passes out of the body through the intestines. When the liver is damaged, its ability to process bilirubin is compromised, causing bilirubin to accumulate in the blood. This excess bilirubin can then be excreted through the kidneys, giving urine a dark amber or brown color. Dark urine can be particularly alarming because it often indicates significant liver dysfunction. Conditions such as hepatitis, cirrhosis, or bile duct obstruction can lead to elevated bilirubin levels. These liver conditions disrupt the normal processing and elimination of bilirubin, resulting in its accumulation in the bloodstream and subsequent excretion in the urine. This color change in urine can be one of the earliest signs of liver disease, appearing before other symptoms like jaundice or abdominal pain become evident. Dark urine as a sign of liver damage is often mistaken for dehydration or diet. People may think their urine is dark from not drinking enough water or eating certain foods or taking medications. While these can affect urine color, consistently dark urine, especially with symptoms like fatigue, jaundice, or abdominal pain, should lead to checking liver health. 2. Abdominal bloating. Abdominal bloating or a noticeably swollen belly is another common yet frequently overlooked sign of liver damage. While many people associate bloating with digestion issues, such as gas or overeating, bloating caused by liver dysfunction, specifically ascites, is the result of fluid building up in the abdominal cavity due to impaired liver function. This happens when scarring of the liver, known as cirrhosis, increases pressure in the portal vein, and reduces the liver's ability to produce albumin, a protein that helps keep fluid within the bloodstream. As albumin levels drop and portal pressure rises, fluid begins to leak out of the blood vessels and accumulate in the surrounding tissues, particularly in the abdomen. This leads to a feeling of heaviness, tightness, and visible distension of the belly. In more advanced stages, The abdomen may appear rounded, firm to the touch, and the swelling may make it difficult to breathe or move comfortably. Some individuals may even feel full quickly when eating, due to the pressure the fluid places on the stomach. What makes ascites a particularly deceptive and concerning sign is how easily it's mistaken for weight gain or simple bloating. Many people may try antacids, laxatives, or dietary changes, only to find that the swelling persists. When abdominal bloating becomes consistent, increases in size, or is accompanied by other symptoms such as fatigue, swelling in the legs, or jaundice, it's a clear warning that the liver may be failing to perform its vital functions, and immediate medical attention is crucial. 3. Intense itching or paritis. This symptom occurs due to the liver's crucial role in filtering and eliminating toxins from the bloodstream. When the liver is damaged, its ability to process and excrete bile, a digestive fluid that carries waste products, is compromised. This dysfunction leads to the accumulation of bile salts in the bloodstream, which are then deposited in the skin, causing severe itching. The itching associated with liver damage is typically widespread and can be particularly intense on the palms of the hands and soles of the feet. It is often worse at night, disrupting sleep and significantly affecting the quality of life. This itching usually doesn't have a visible rash, which sets it apart from other skin conditions. Without a rash, it can be hard to diagnose, causing many to miss the liver as the source of the problem. One of the primary conditions linked to liver-related itching is cholestasis, a situation where bile flow is reduced or blocked. Cholestasis can be caused by various liver diseases, including hepatitis, cirrhosis, and bile duct obstructions. The buildup of bile acids in the skin stimulates nerve endings, resulting in the itching sensation. The exact mechanism by which bile acids cause itching is not fully understood, but it is believed to involve complex interactions between the nervous system and immune responses in the skin. What makes intense itching a particularly strange sign of liver damage is its indirect nature. People do not usually associate itching with liver problems, as they are more likely to think of allergies, skin conditions, or kidney issues. This disconnect can delay proper diagnosis and treatment of the underlying liver condition. Furthermore, standard anti-itch treatments such as topical creams and antihistamines are often ineffective in relieving liver-related itching, underscoring the need to address the root cause. 4. Easy bruising or red rash. The liver plays a crucial role in the production of proteins essential for blood clotting, such as fibrinogen and clotting factors. When the liver is damaged, it produces fewer proteins, making it easier to bruise and bleed even from minor injuries. Bruising occurs when blood vessels beneath the skin are damaged and blood leaks into the surrounding tissues. In individuals with liver damage, the reduced production of clotting proteins means that even small impacts can cause significant bruising. These bruises often appear more extensive and take longer to heal compared to those in individuals with healthy liver function. The ease and severity of these bruises can be alarming and should lead to checking liver health. Unusual purple or red rashes on the skin, particularly on the lower legs or arms, are also indicative of poor blood clotting and circulation associated with liver damage. These rashes, known as purpura or petechiae, are caused by bleeding under the skin. Petechiae are small pinpoint red or purple spots, while purpura are larger patches. Both types of rashes result from the liver's impaired ability to produce sufficient clotting factors, leading to bleeding into the skin. Additionally, liver damage can cause a condition called thrombocytopenia, where the number of platelets, cells involved in clotting, in the blood decreases. This reduction in platelets further exacerbates the tendency to bruise easily and develop rashes. The underlying liver disease can also lead to portal hypertension, which causes blood flow to be redirected from the liver to smaller fragile blood vessels, increasing the risk of bleeding and bruising. What makes these symptoms particularly strange is that they are often mistakenly attributed to other conditions, such as skin disorders or blood diseases rather than liver dysfunction. 5. Pressure or pain on the right side of the rib cage. This discomfort arises from the liver's location in the upper right quadrant of the abdomen, just beneath the rib cage. When the liver becomes inflamed or enlarged due to damage, it can press against the surrounding tissues and organs, leading to a sensation of pressure or pain. One of the primary reasons for this symptom is hepatomegaly, which is the medical term for an enlarged liver. Hepatomegaly can occur due to various liver conditions such as hepatitis, fatty liver disease, or cirrhosis. As the liver swells, it stretches the capsule surrounding it, which is rich in nerve endings. This stretching causes discomfort or pain that is often felt under the right rib cage, and may extend to the right shoulder or back, depending on the extent of the swelling. Another contributing factor to this right-sided pain is the accumulation of bile within the liver. When the liver is damaged, bile flow can be obstructed, causing it to back up and increase pressure within the liver. This buildup can lead to the formation of bile sludge or stones, which further exacerbates the sensation of pressure and discomfort in the upper right abdomen. The pain can also be linked to portal hypertension, a condition characterized by increased blood pressure within the portal vein that carries blood from the digestive organs to the liver. This heightened pressure can cause the liver and spleen to enlarge, contributing to a feeling of fullness or pain on the right side of the rib cage. What makes this symptom particularly strange is that many people do not immediately associate it with liver issues. Instead, they might attribute it to gastrointestinal problems, muscular strain, or gallbladder disease. 6. Swelling in the right foot and ankle. Swelling in the right foot and ankle can also be a sign of liver damage, known as peripheral edema. This happens when fluid builds up in the tissues of the lower body. While many conditions can cause edema, its link to liver damage is often unnoticed. The liver is crucial for maintaining fluid balance and producing proteins like albumin, which helps keep fluid in the bloodstream. When the liver is damaged, it produces less albumin, reducing oncotic pressure and allowing fluid to leak into tissues, causing swelling in areas like the feet and ankles. Liver damage can also increase pressure in the portal vein, leading to fluid buildup in the legs and feet. Swelling in the right foot and ankle may be more noticeable due to the liver's position and blood circulation patterns. This symptom is often missed, as edema is usually linked to heart or kidney problems. 7. Pale stools. Pale stools are also a strange and often overlooked sign of liver damage. Typically, stools are brown due to the presence of bile, a digestive fluid produced by the liver that helps break down fats. When the liver is functioning correctly, it releases bile into the digestive tract, where it aids in digestion and imparts the characteristic brown color to stools. However, when there is liver damage, this process can be disrupted. The bile ducts may become blocked, or the liver may not produce enough bile, leading to a noticeable change in stool color. This pale or clay-colored stool is unusual because it indicates that bile is not reaching the intestines in sufficient quantities. The lack of bile causes stools to lose their typical brown hue, resulting in a lighter, sometimes almost gray appearance. This change can be alarming and is often one of the first noticeable signs of liver issues for many people. It suggests that there is an underlying problem affecting the liver's ability to produce or transport bile. The presence of pale stools can be linked to various liver conditions, including hepatitis, cirrhosis, and bile duct obstructions. These conditions can severely impair the liver's functionality, leading to a buildup of bile in the liver or bile ducts, which in turn affects stool coloration. 8. Difficulty seeing at night, night blindness. The next unexpected sign of liver damage is difficulty seeing at night, known as night blindness. Night blindness occurs when the eyes struggle to adapt to low light conditions, making it hard to see in dim environments. This symptom is particularly perplexing as it directly connects to the liver's role in processing and storing essential nutrients, specifically vitamin A. Vitamin A is crucial for maintaining healthy vision, especially in low-light situations, and is a key component of rhodopsin, a pigment in the retina that enables vision in low-light conditions. The liver plays a pivotal role in converting and storing vitamin A, making it available for use in the eyes. When the liver is damaged, its ability to process and store vitamin A efficiently can be compromised, leading to night blindness. Liver damage can reduce bile production, which is essential for the absorption of fats and fat-soluble vitamins like vitamin A. Insufficient bile means that vitamin A cannot be absorbed properly from the diet, leading to a deficiency. This chain reaction highlights how a problem in the liver can manifest in an entirely different part of the body, demonstrating the interconnectedness of bodily functions. Night blindness as a sign of liver damage is often overlooked because people typically associate vision problems with eye conditions rather than liver health. 9. Visible spider veins. The next strange sign of liver damage is visible spider veins. These small web-like clusters of blood vessels typically appear near the surface of the skin and are often red, blue, or purple in color. While spider veins are commonly associated with aging, sun exposure, or hormonal changes, their connection to liver health is less well known, making their appearance an unexpected indicator of underlying liver issues. The liver plays a crucial role in regulating blood flow and maintaining the integrity of blood vessels. When the liver is damaged, conditions such as cirrhosis or chronic liver disease can lead to increased pressure within the portal vein, a major vessel that carries blood from the digestive organs to the liver. This condition, known as portal hypertension, causes blood to be redirected to smaller superficial veins, leading to the formation of spider veins. Spider veins are particularly strange as a sign of liver damage because they are often mistaken for cosmetic or peripheral vascular issues rather than symptoms of a serious internal condition. People might seek dermatological treatments to remove these veins without realizing that their presence could signify more significant health problems. The appearance of spider veins in unusual locations, such as the upper chest, neck, or face, can be a critical clue pointing towards liver dysfunction. The hormonal imbalances caused by liver damage also contribute to the development of spider veins. The liver metabolizes various hormones, including estrogen. When the liver is impaired, estrogen levels can become elevated, weakening the blood vessel walls and making them more prone to dilation and visibility. 10. Chronic fatigue and low energy. One of the most overlooked yet common signs of liver damage is persistent fatigue and a constant lack of energy. While it may be tempting to attribute chronic tiredness to stress, aging, or lack of sleep, it can also signal that your liver is under strain. The liver plays a vital role in metabolizing nutrients, detoxifying harmful substances, and producing energy. When it becomes damaged or overburdened, these functions become impaired, leading to a noticeable decline in energy levels. In individuals with liver dysfunction, toxins that should be filtered out begin to accumulate in the bloodstream, which can interfere with cellular metabolism and brain function. This toxic buildup contributes to feelings of heaviness, mental fog, and general malaise. Additionally, liver damage often results in decreased production of glucose and reduced storage of glycogen, which are essential for sustained energy throughout the day. What makes fatigue a particularly misleading sign is its broad range of potential causes. People experiencing this symptom may explore thyroid, adrenal, or sleep-related disorders without considering their liver. However, if low energy persists despite adequate rest, a balanced diet, and proper hydration, it's important to evaluate liver health as a potential underlying factor. 11. Loss of appetite and unexplained weight loss. A reduced appetite or sudden, unexplained weight loss can be a subtle but telling sign of liver damage. While it's common to associate appetite changes with digestive issues or emotional stress, the liver plays a direct role in regulating hunger and metabolism. When the liver is compromised, its ability to produce bile and process nutrients is affected, which can lead to nausea, early satiety, or a general disinterest in food. Additionally, liver damage often causes inflammation and hormonal imbalances that disrupt the normal signals controlling appetite. In more advanced stages, such as cirrhosis or liver cancer, muscle wasting and rapid fat loss can occur, even when caloric intake remains unchanged. This type of weight loss is known as cachexia and is typically linked to chronic disease and metabolic dysfunction. What makes this symptom particularly deceptive is that it may be initially perceived as a positive change, especially for individuals trying to lose weight. However, when appetite loss is persistent and accompanied by fatigue, digestive discomfort, or changes in stool or urine color, it should prompt further evaluation of liver health. Ignoring this sign may lead to missed opportunities for early diagnosis and intervention. The liver is one of the few organs with the extraordinary ability to heal and regenerate, but only if you remove what's harming it and give it the nutrients it craves. That journey begins in your kitchen. Cut back on refined sugars, processed starches, and especially fructose and alcohol, two of the most damaging substances for liver health. Instead, embrace foods rich in sulfur like garlic, radishes, leafy greens, and broccoli. These help boost glutathione, your liver's master antioxidant. Try starting your day with organic coffee and a pinch of turmeric. This combo has shown promise in reducing liver fibrosis. Consider intermittent fasting, limiting your eating window to just 6 hours a day, allowing your liver time to repair and reset. And don't forget to replace inflammatory seed oils with nourishing fats like olive oil and coconut oil. Finally, purified bile salts can support fat metabolism and prevent gallbladder stones, giving your liver one less thing to worry about. Your liver is always working for you, silently filtering toxins, fueling your metabolism, and protecting your entire body. But when it starts to suffer, it whispers, not shouts. These 11 strange signs we explored today are not random quirks, they're messages your liver is begging you to hear. And the sooner you listen, the more power you have to change the outcome. If this video opened your eyes, please give it a like and share it with someone who might be ignoring these signals. You might help them catch a serious problem before it's too late. And if you haven't already, hit that subscribe button. We're here to bring you science-backed, life-changing tips that empower you to take control of your health naturally and confidently. Thanks for watching, and remember, healing doesn't start in a hospital, it starts with awareness. It starts with you. We'll see you in the next video.